please click yes, so you're giving consent to me, so we are recording this. Here is what we're gonna do. I'm gonna go ahead to share my screen, give a little bit introduction of why we're doing this today. And then we are going to jump right into the interview portion with some pre-selected questions. And I do want to leave ample time for us today to have a dialogue on important questions that might allow to my community, specifically the Asian American community, but also all of you with everything going on in the country. As you can see on the screen, this is our interview series. I'm very delighted and honored to have Shervin Aazami with us today as the first interviewee for our Civic Leaders interview series. So I'm the VP of our Outreach Cheer, which is a newly founded nonprofit organization to promote holistic education and also civic engagement. You can see a lot of our mission statements are surrounding like the intercultural leadership part and how important it is for us today to focus on the community with everything being very polarizing and with everything concerning us, how we are supposed to really emphasize the solidarity between among different groups. And again, I'm going to do about 30 minutes or even less, also the pre-selected questions with a little bit background about Shervin. And then, and in the meantime, please feel free to chime in by answering the chat, any comment or questions, so I can actually incorporate them in the interviews. I would like this to be a very intimate setting, so we can have a dialogue instead of just me asking cold questions. And then I'm gonna have a Q&A session, and you can just unmute yourself or raise your hands. Now I'll call your name to comment, to ask a question, to add something you want to share. Okay, a very, very brief introduction of Shervin. I would like him to also talk more about himself. But some highlights about his background that's very interesting to my community is the fact that he was born in Italy and immigrated to the Valley at the age of 2. So I might be asking questions about his experience as an immigrant engaging civically, if there has been any difference. Because me personally, I'm a first generation Chinese American. Secondly, same to Shervin, I am also UCLA alumni. So he graduated from UCLA, and he, after graduation, actually moved to Washington, D.C. as the health department's HIV screening coordinator. So there are a lot of interesting background on how he dedicated himself to health equity, to social justice through the lens of public health. So I think I'm more interested in that as well. And many of our parents are as well, like how a lot of kids who are passionate about STEM can also be civic engaged, how to have that lens in their work, in their career. And lastly, just a brief summary of him. He's a public health activist, a husband, actually a soon-to-be dad, and also a working class champion fighting for the social justice and racial justice. So I'm gonna stop sharing now, and I want everyone to focus your attention on Shervin. Thank you, Shervin. Very glad to have you today. Would you like to give anything to the introduction I just gave, or should we just jump right into the interview?
Happy to jump right in. Very grateful to be here. Thank you to Cheer. Thank you, Yi. Very, very excited to be here with you all tonight.
Thank you. Okay, so I'm going to start with the easier questions, and then we might have some more challenging ones. I am very curious, personally, very curious about if there were any pivotal moments in your childhood, adolescence, or even college life that made you want to go into politics.
That is a great question and a good place to start. I think the simple answer is, like many folks, I never grew up wanting to be in politics. It's never something that was in the back of my mind growing up, that being an elected official was going to be my path. But I've always been a big picture thinker. I've always been a systems level thinker. And as you pointed out, I've been fighting for social justice through the lens of public health. And to explain a little bit about what that means, the public health discipline is very intersectional. It's focused on the root causes of our social and economic issues. As opposed to putting Band-Aids on bullet wounds, we think about what kinds of actions led up to the issues we now see today. What are those root causes? How do we go back and look at those intersectional root causes and think about prevention and put our minds, our tools, our resources towards preventing social and economic issues and understanding how various facets of our life, our environment, our built environment, our physicality, all those things impact our health, our access to things like housing, to education, to employment, to a living wage, our built environment in terms of our access to clean air and water. All those things collectively impact our health. So it really separates that from the traditional lens of focusing on healthcare and treatment and thinking about what is about the entire environment that dictates our community health outcomes. And, you know, growing up in a working class neighborhood, you know, both my parents, they fled religious persecution as teenagers in Iran with the clothes on their backs and a little bit of resources, and built everything they had from the ground up. And they instilled that sense of responsibility, that sense of work ethic and dedication from a very early age. You know, I watched my mom work in retail for most of my youth, working long hours, nights, weekends, holidays, whenever it was, being the primary breadwinner for our family. While my dad went back to school after being a doctor, becoming a gastroenterologist in Italy. When we emigrated to the United States, he had to start from scratch, start all over again. And it was in the wake of the 1994 Northridge earthquake where he made the decision to start anew and rebuild. And we moved a lot when I was growing up. There was a lot of instability, but there was always love. There was always commitment. There was always that sense of support from within the family. And I'm very fortunate to have had that. Many immigrant families don't have the privilege and the fortuitousness of being able to have grandparents to raise their young ones like I did. And, you know, I think about the sacrifices that my parents made to be able to build a better life, the toil and the struggles they went through each and every single day to make my life easier. And I was able to kind of thrust myself into the work of social justice, the lens of public health, by seeing all the work that my family did, all the struggles and sacrifices they made for the betterment of their community and their family. And so that's always been the lens that's guided my work. And as I shared earlier, I've always been a big picture thinker. But when I started in public health, it was always on the programmatic side. So implementing HIV prevention programs, doing health education within our schools, designing substance use prevention and outreach programs through a community lens. And there were always barriers in doing that work. And when I first started out doing that work here in LA for a residential treatment center, when I was doing it in San Francisco for the Alliance Health Project, who would provide outreach and healthcare services to our LGBTQ plus community members, there were always political and policy barriers in the work that I could do. Or we tried to implement a program, but it was always like, well, we can't spend money on that. We can't design the program that way, even though the community wanted us to design the program that way. There were always those kinds of logistical, policy, funding, and political barriers. I remember one of the best examples of that when I was the HIV screening coordinator for the Washington, D.C. Department of Health. There were outbreaks of chlamydia and gonorrhea among adolescent youth, primarily young, low-income Black teenagers in the city of D.C. between the ages of around 15 to 22. And our job was to go into those schools, build those bridges with the principals, with the families, and implement STI screenings, free STI screenings for students, sexual health education, access to contraceptives, and so forth. And there was one private school in the city that we had not worked with, but the principal ended up reaching out to my boss at the time because they had noticed an outbreak of chlamydia among their high school students. And they wanted us to come in and provide the STI screenings but said, we don't want any health education. We don't want any pamphlets. We don't want any contraceptives. We just want you to come in, do the screenings, and get out. Don't talk about anything. Don't share any resources. Don't talk about prevention. None of that. We just want the screenings. And I was incensed. I was incensed by this because I was like, well, we're totally missing the real focus here, which is to give kids the tools they need to make informed decisions, to take control of their own health care and understand how to keep themselves and their partners in the community safe. And I remember I got all angry and I felt so self-righteous. I was like to my boss, give me the phone number of the principal right now. I'm going to call them right now and take care of this myself. And she gave me this look like, I just got off the phone with the city health commissioner and the CDC public health advisor stationed here at our city health department and the superintendent from the school. And we all collectively decided this is where we're going to go forward. And you know better than we do? That really put me in my spot. But the anger didn't go away because I still felt like, no, what's right is giving the kids the tools they need. But you know, I kept my mouth shut. I went forward with it. And guess what? 5 months later, there was another outbreak and we were brought back. And again, we were told no health education, no contraceptives, just do the STI screenings. I kept thinking to myself, here we are, we're expending all these city resources. We're going in again and again and again to give these kids care, but we're denying them access to the tools and education and resources they need to prevent those outbreaks of chlamydia and gonorrhea. And if we had just spent that time invested in that upstream prevention, in those access to resources, informing kids how to use contraceptives, what sexual health education is all about, could we have prevented a second outbreak or at least mitigated it? And that kept those barriers kept informing why I felt like we needed new solutions. And I kept thinking, well, what are these policy and political barriers? And then I would think back to how, you know, we have millions of Americans living paycheck to paycheck. We have millions of Americans that are uninsured or underinsured, despite the fact that we spend more on healthcare per capita here in this country than any other developed nation. We are the wealthiest nation in the world, and yet we have tens of thousands of Angelenos here in our city that are unhoused. We have 5 unhoused Angelenos dying per day here in Los Angeles. We already have a $15 minimum wage here in LA, but because cost of living is so high, you have to be making $38 an hour in order to avoid paying over a third of your income to rent. Well, that's leaving frontline workers behind. That leaves grocery store workers behind. That leaves a lot of healthcare workers behind. That leaves sanitation workers behind. That leaves our educators behind. And all this anger, we have a racial caste system here in America where your race, your class, your background, your zip code dictate your access to basic necessities like housing, like healthcare, like education. And all of that is informed by policies. Policies based in prejudice, based in oppression, based in displacement, based in genocide, that we have failed to reckon with over and over and over again. And I kept thinking to myself, if I'm going to be this angry all the time about our systems, well, then I need to do something about it. And so that's when I started working more in policy. And I made that transition over to the CDC. And through that 2-year fellowship with the CDC, I was stationed at the National Indian Health Board, which is a 501c3 nonprofit that advocates to the federal government to fulfill their treaty obligations to tribal nations. We have nearly 400 treaties signed with individual sovereign tribal governments. From the time the United States was founded up until the 1880s, when we transferred that power over to Congress, we signed treaties in between that 100-year time, over 400 treaties. And we have abrogated each and every single one of them. Where we have upheld our treaties with European nations, We have failed to uphold those treaties with tribal nations. And as I kept doing that work more and more, and educating myself and exposing all the systemic inequities that exist in our system, that anger drove me to run for office and say that I need to go back to my community and work within my community, elevate grassroots voices, elevate the incredible work our community organizers are doing, and work collectively in that struggle for change to fight for, advocate, and achieve the structural reforms we need to guarantee the basic necessities everyone needs to survive. One more time, I want to say we live in the wealthiest nation in the world. There is no reason why we cannot guarantee healthcare, housing, and education as basic human rights. What we have lacked always is a political will. And our campaign here in our community is here to change that. And most importantly, we live in a district that is safely Democratic. There is no real threat of Republican leadership here. So why then is our representative not introducing bolder reforms? Why are we not advocating more fervently for the structural changes we need, like single-payer Medicare for all, like guaranteeing housing like for all, establishing a 21st century public education system, decriminalizing our immigration system, investing in healing, abolishing our carceral system of punishment, and investing in our communities? We can do that, and we have to do it.
Thank you, Shervin, for sharing your anger. I think it was very rare to see that, I think, vulnerability and that authentic emotions many times in those interviews. So, and I echo your point on those housing, healthcare, education, and same here. I used to be, maybe still now, I look like I'm so polite. I'm an educator, so I tend to just make sure that I understand others, make sure I am empathetic. But it's really this anger, I think, that motivated me to actually connect with you and to feel like we ought to have those conversations, and I ought to have this dialogue with you and to share with our community. And many things you shared, and also what happened at Echo Park. I've been following on Twitter. I know it's just so disturbing. I can't stop talking about all the issues that you mentioned, but what I do want to highlight in your very inspiring speech about what you have experienced or what motivated you was you mentioned how you inherited that love, that sense of responsibility from your family. I think that's a very unique thing I hear these days. The reason being, I know at least within my community, within Asian American community, there has been a generational gap in terms of understanding of different social issues, or even just outright political views on what you just mentioned on housing, on education, and actually on sex ed. That's, I think, one big issue. So I wonder, I personally share with you all those viewpoints, but I also recognize we do have parents, kids, we have different generations within my community. And I wonder if that is the case within your community as well. I know your dad is here. I wonder if you want to comment on that or not. But my question is whether or not there is that generational gap. How do you personally deal with those type of things, either within your own family or among your community, or maybe in other communities? How do you deal with that personally, or recommend us do so, that we are uniting instead of dividing our community?
Yeah, absolutely. And my father and I have a lot of conversations about policy. That's one thing that I'll say has kind of changed within the past few years. We've become a lot more open in having those transparent conversations about how we feel. And we get into a lot of healthy arguments. But, a lot of these subjects are taboo. Sexual health education, for one, is extremely taboo in the Iranian community as well. Many conversations, as you pointed out yourself, Yi, when it comes to housing, guaranteeing healthcare, all of these things, especially from an immigrant lens. I think that, one thing that perhaps is a little bit different with my parents is that they fled religious persecution at such a young age. They were teenagers, and they spent a lot of their later formative years in Italy, growing up in that culture with their friends, fellow expats from Iran. It really created their own community. And that being said, still having these conversations around racism, around sexism, homophobia, transphobia, class warfare, these are not easy discussions to have. But accountability always starts within our own families. We must be willing to have those open and honest conversations with our parents, with our grandparents, with our aunts and uncles and cousins about how we feel. And, it's never going to be easy. Decolonizing ourselves is painstaking work, and that's okay. I think that's the most important message is it's okay to understand it will be difficult. And approaching those really seedy, really taboo conversations, it takes a lot of guts, takes a lot of courage. And we have to be willing to give each other that grace, to show that humility, that empathy, and understand that it's work in building equity, building justice, building understanding in our communities and with our own families. It's work. But it has to start with us. It has to start within our own backyards. And it really kind of grows from there, is all I can say.
Thank you, Shervin. And it says a lot that your dad is here supporting your campaign, because I think a lot of things you're supporting may not be a consensus among your community or his generation. So I think that says a lot about how you're handling this, not handling, but you're navigating through challenging conversations. Well, I like how you said this is work. It's not really, let's not romanticize this. This is not going to be a magic, I don't know, a panacea to solve anything. Yeah, it's really, let's embrace the uncertainty, the uncomfortable feelings, even anger. And I think I really appreciate that part of how you're motivated to fight for those issues. And I think one specific issue that is very important to my community, and I mentioned to you earlier, is the horrific surge of anti-Asian hate crimes. It's heartbreaking to see all those surge of cases. And according to the stats on anti-Asian hate crime reported to the police in America's largest cities, LA actually has the second most crime cases, and California has the highest percentage of those cases in 2020. So I'm sure you're aware, within many communities, they have been actually turning to not necessarily gun purchasing, but there has been a growing concern with public safety, which inevitably led to more reliance on the police that I know many progressives have been advocating for abolishing. I'm not gonna ask you some point really on specifics on this issue, but I do want to ask, how do you make out this dilemma between, not necessarily dilemma, but I know there are just a lot of nuances when we talk about decriminalizing the legal system and public safety. And what's your vision of this, given our concerns of public safety within the actually within all communities, but I want to ask on behalf of my community, my Asian American community.
Thank you. It's such an important question to ask. When I think about the fact that we had over 3,800 anti-Asian hate crimes over the past year, the vast majority of which disproportionately targeted Asian women. And one perspective that I have is when we use terms like hate crimes, it really tends to look at it through the lens of the individual. Individuals are, of course, the ones who perpetrate these crimes. But we have to, when we focus on the individual, we tend to overlook how our systems perpetuate hatred, oppression, discrimination, and sexism. This isn't just about individuals. It's that larger system of persecution which imbues that hatred in someone's heart. And we have to recognize that anti-Asian violence and discrimination is nothing new. It's as old as America. Our very earliest anti-immigration laws targeted Asians. Even most folks think about the Chinese Exclusion Act of 1882 as the very first anti-immigrant law. There's actually one that preceded it. It's called the Page Act of 1875. And that law specifically targeted Chinese women and subjected them to brutal, humiliating, and racist medical exams in the port of entry in San Francisco. In practice, it was meant to stop the continued migration of Chinese people to the Americas and Asians in general, while the United States continued to exploit the cheap labor of Asian men to build US infrastructure and build the railway systems. They were denying Asian women from immigrating to America. And a lot of the stereotypes of that era, a lot of the ads and the propaganda stereotyped Asian women as highly promiscuous, highly sexualized. And that consisted throughout American history and even today. Think about that when we remember that Robert Aaron's heinous crimes in Atlanta, where he murdered 8 women with impunity, 6 of them Asian women. And he complained about a sex addiction. And we know more that he targeted massage parlors that were either Asian owned or that had a high number of Asian employees. And that hypersexualization of Asian women. We can draw a direct thread between that and the very first anti-immigration law in the United States that specifically targeted and excluded Asian women. That's a very difficult history to think about, but it's also the history we have to reckon with in order to understand what healing looks like. So much of racism is rooted in misogyny and sexism. And when we think about the fact that that anti-Asian sentiment here in California at the time of the passage of these laws, because white men saw Asian men as competition with the California gold rush, and white people in general grew to see Asians as a racial, economic, religious, and social threat to white hegemony here in America. That racism is as old as America. And if we don't reckon with that history, then we are damned to allow these heinous acts to continue in the future. These acts are not random. They are coordinated. And they are built into a system that has failed to understand our history of racism and displacement and genocide and slavery. And so on the topic of policing, we also have to recognize that white supremacists have infiltrated police for decades. Numerous FBI reports have demonstrated this, and we have failed to act. And think about what the police said after Robert Aaron committed those heinous acts. They said he was having a bad day. He was having a bad day, and completely glossed over his racism, completely glossed over his sexism. And class is part of this too. Several of those women were sex workers. And we have to understand how these issues intersect class, race, and sex and gender to disproportionately marginalize our communities of color. And here again in America, the biggest threat to our militarized police is the community taking care of each other, investing in healing, investing in services, investing in basic human rights, guaranteeing things like healthcare and education and housing, things that ensure people's basic needs are met. That is the biggest threat to policing. That does away with their oppression. And budgets reflect priorities. Our priority is not investing in healing. Our priority is investing in policing. All we need to do is look at the numbers. In 1992, state and local governments per capita spending on policing was $132. In 2017, it's $352. At the federal level, we spend more than $100 billion on policing and $740 billion on the military. We spend less than 6% of that on housing, less than 9% of that on public education. Here in LA, we have an over $3 billion police budget. In comparison, our homelessness budget is $400 million. We cannot police our way out of social and economic issues. How we solve those issues is investing in our communities. And that can be a very difficult subject to broach with a lot of immigrant families, including within the Iranian American community. And that's why, going back to my earlier statement, decolonization is work. It's actual work. It will not happen overnight, but we all have that obligation to start within our own communities, within our own households, and having those open and transparent conversations around what healing and justice and equity look like.
Thank you, Shervin. This is a fantastic segue to our Q&A section. I do want to leave it up for our attendees today. If you have any questions for Shervin, I personally just been really into all those lands that are intersectional, that are systematic. I as an educator, that's how I also see a lot of educational problems, of challenges our students are experiencing, instead of looking them as in a deficit lens. I'm seeing more as systemic problems that we are in need of solving, like through really working together with different communities and really thinking about how to address this in the long term. Also looking at the history of the problems, the root causes, as Shervin mentioned. If you want to ask a question, you can unmute yourself, raise your hand, or type in the chat. Any questions for Shervin? Or comment, that's good too.
I have a question.
Yes, Meitin, go ahead.
A question also, maybe comment integrated. Thank you for being here. I'm a fan of the very well-known Iranian historian. I'm sure you all know Harari, right? And in a recent interview, he mentions that it is so easy to pick up differences and similarities in human society, but we tend to identify with differences, which according to him is the source of all the problems, such as the recent surge of racial crimes. But in fact, right, science has shown that the biological differences, like DNA-wise, between different races, let's say white and black, are so tiny. In many cases, less than 2 people from the same race. So what run through our individual bodies and make us function on a daily basis are the similarities that define us as human beings, a singular species, different from other species, let's say like a dog or bird, right? So all the differences that have occupied so much the mindset of the majority are all basically fabricated, right, by those in power over time for various reasons such as religious, political, economic. So identifying with differences have effectively prevented human beings advancing to a higher level of consciousness as a species. So I'm curious, what's your idea of educating the public about the similarities of us as a sapient, let's say?
Those were wonderful points. Thank you so much. Everything you shared just further reaffirmed how race and sex and gender, a lot of these things, they're social constructs. And to your point, they're established in order to concentrate power in the hands of the few at the expense of the many. And so back to my earlier point around how that decolonization takes active work and investment upon all of us individually to decolonize ourselves, and then collectively as a community. I loved your comment about focusing on the similarities. I think in order to get there, we have to start with having an honest reckoning of our past and how we got to these levels of warfare in between our communities, where we fail to understand those intrinsic similarities. We fail to understand how when we invest in one another, in our neighbor, we all see the benefits. 7 generations on, we see how we can build a community of love and investment and healing by seeing one another as intrinsically part of ourselves and our communities. And that's why I'm saying it really has to start with that honest reckoning of how we came to be this way. Because we have this national narrative, right, that we're all created equal, that we're all children under God, and that's a beautiful message. But in practice, that's not what we're seeing. When we see all these inequities baked into our system, across class, across our economic outputs, across our health, across our zip code, when things as minute as your zip code dictate your ability to survive, and how those things are built around the color of someone's skin, the language they speak, the culture, the religion they ascribe to, where they come from, how those things dictate your ability to survive, we have to take a step back and recognize that truth, recognize that problem and how it exists at a structural level, to be able to fully reckon with how we engage in the solutions. So thank you so much for all of your comments. I couldn't agree more.
And if I can just follow up, sorry.
Sure.
Yeah. So yeah, I resonated very well with what you earlier what you were saying. Like we need a really bold imagination or take bold actions. Like I mean, think about it. Science has made such progresses with all the fantastic inventions and achievements. Oftentimes, as a result of bold imagination experiments, and they are not talking about sending people to Mars, right? But in the domain of social life and politics and governance, we are so limited. Like we are clinging to the tools invented several hundred years ago. That's how we're still living in the tools invented by our ancestors. So I really agree that we need to reimagine how we run our society, right?
Absolutely. Thank you so much.
Thank you, Meiqin, for your question. Great comment. Any other questions for Shervin or comment? Disagreement is fine too. Concerns, homework for him to do after this. I'm saying that because Meiqin is actually a seasoned professor that been having other conversations on this as well. Yasmin, do you want to chime in?
Sure.
Go.
Can y'all hear me? My earbuds have been awful.
Yes, hear
lately.
perfectly.
Okay, good. Sorry, I had to escape from my living room to the office. My partner was watching something. No, I just wanted to thank Shervin for drawing attention to the importance of education in all of the areas that he discussed tonight. And I'm an educator as well. I teach high school English. And I agree with him 100% that when we're not teaching certain aspects of reality, life skills, that we're doing a complete disservice to our students. So thank you for bringing that up and acknowledging the importance of education and educational justice, because it does affect all areas of the injustices that we're witnessing in our world today.
Thank you, Yasmin. Thank you for running for city council. You're a phenomenal
Yes.
leader. And go ECR.
Yeah, thank you for chiming in, highlighting the role of education. I actually got involved in neighborhood council only since the pandemic, so I'm learning everything you are sharing, and yeah, thank you for running, both of you. Any other questions, comments? Louis, I see you just unmuted yourself. A question?
Yeah. Shervin, do you mind I ask a question to your dad?
Sure, of course.
And
Let's do
if
it.
he agree with us, senior Mr. How do you say your last name? Aazami. Aazami. You know, during the whole interview, I mean, that's because your face, your like the picture is just like definitely in the middle of on my top, and I can tell how you're proud of you like proud of your son. I can tell. I mean, that's like from your face. But I just wondering because like me or or both like the first generation, we have kids now, and I'm wondering. First question: do you think Shervin just grow up as you expected, or you have some expectation on him, and then? Okay, I mean that's maybe.
Don't answer that one, Dad. It's a trap. No, I'm kidding. I'm kidding.
Because I can tell that your relationship between you two is so close, and that's really wonderful. And I would like to, because you know, maybe you guys just to take our like Asian parents as like, oh, what? I'm not a tiger mom, honestly. I'm here to say that. But I would like to see that's how you supported him to, you know, build up his career like that. And that's why I asked you what did he grow up as you expect? And if not, if yes, what did you like to do support him doing, especially doing that like in the middle school and high school?
Absolutely, that's a very nice question. I'm very happy that you are asking me that question. You know, Shervin and I, besides being his father, he's my best friend. We talk all the time. We discuss about many issues together. As a matter of fact, today, for example, we talk about many issues. Whenever we see each other, we talk, okay? Because, you know, I tell him as a physician what type of the problem I have to treat my patients. And then at the same time, I want to see his opinion. You know, we have the challenges in life. So my personal life as a physician, as an immigrant coming to this country and facing all the difficulties I had to become a certified physician and practicing medicine in this country, I see that's lots of challenge. So that is, I see that as a physician, why I should have this type of challenge. I have to think about how to treat my patient. I shouldn't think about all other things and wasting my time. I can tell you around 70, 80% of my time is not a patient care. It's only maybe 20% of my time is a patient care. Why should it happen like that? Because, you know, I have to think only how to treat my patients. So this, because of some other issues that we have in this beautiful country. As he mentioned, United States is the wealthiest country in the world. But thinking about the healthcare system, maybe not. Okay, so some issues that should be fixed. Some issues should be reviewed, probably needs a revision, good revision, and in order to get better. So, you know, Shervin is the type of the person I personally think, and he knows what he's doing. And he shows his anger, because he's angry because you see that things are not doing, you know, he wants to do that in the right way. You say, why we are spending time to doing things that shouldn't be in a different way? So I see his anger, and then that fulfill my personal desire. He talks what I have to say. So that makes me proud, first of all. And then I'm very, very happy that he's running for Congress, because we need someone like him in order to fix things. And then in order to overcome all the difficulties and the obstacles we have in our life.
Thanks, Dad.
Well,
Proud to
thank
hear
you.
so.
Yeah, I'm so moved. Thank you. Oh, Robert, do you have something to add?
Well, I'd like to ask a question of Shervin. I've been listening to how you can help us with public health situations, but I also know you have a master's degree in public administration. I'd like to hear your comments on how that master's degree will serve us in Congress. But before I stop, I want to apologize for taking this call in bed. I'm here with pneumonia, so I'm laying in bed. But can you tell us put some color on how the master's degree in public administration will help you in Congress.
Of course. Thank you, Robert. Thank you for being here, and I hope you feel better soon. You know, when I was getting my master's in public health, at that point, I'd been working in the public health field for several years. And getting the degree was kind of the final step, if you will. And what I noticed in the public health master's program, and this was unfortunately true of most MPH programs across the country, there is a heavy focus on programs, very little focus on government. So while you're focused on implementing whatever kind of public health program it is, substance use prevention, environmental health protection, health promotion, disease prevention, whatever it is, you're focused on the program design, evaluation, implementation, all that good stuff, but not really how the politics and the policies inform that program design, program implementation, evaluation, and so forth. So that's where the MPA came in. Because I got an MPA with a focus on local governments, really focusing on how we navigate our very large, very bureaucratic systems of government at the federal, state, and local level to be able to achieve the structural reforms that we want to work on. And that's one of the main reasons why, as we launched our race, our campaign has really made a point to try to work really closely with folks running for state assembly and city council. And so with folks like Yasmin, like others who are running on very similar platforms here in LA, all of us want to focus on guaranteeing housing as a human right. We're all focused on enacting things like single payer Medicare for all. But being able to implement that properly across the federal, state, and local level requires real coordination, real camaraderie, real communication. And that's where the MPA stepped in, is how do we build those systems to be able to achieve the policy goals that we have?
Thank you.
Of course. Great question.
Thank you, Shervin. I love how you keep going back to the importance of work. It's really not romanticizing things that those are deals, but ultimately it's the hard work we need to do. Any last question we want to ask Shervin? Comment? Well, I guess that's it for tonight. I am really grateful to have you with us today, Shervin, and also everyone who commented. Your dad hasn't. Thank you so much for sharing everything. That's very encouraging for me to hear. I have a 2-year-old. I really want him to grow up feeling loved, supported, and most importantly, motivated to make positive impact in the world. So thank you for sharing, and your great questions, Mei-Chin, Yasmin, your comments, and Robert. Thank you, everyone. Hope you'll take care. Have a good night and a wonderful week.
Thank you so much. Thank you for having me. Thank you all for joining, and I hope to be able to speak with you all again soon.
Thank you.
Yeah.
Thank you.
Now to
Thank
see
you,
everyone
everyone.
in person someday.
Yes, that'd be great.
Bye. Take care.
Bye.
Stay safe, everyone.
So Helen, you're still here. Do you have a question?